Dr. Axe here, and I want to explain what to expect from our functional medicine program. We have a two-step process that we use. And that first step of the process is sitting down with you, getting a full history, you bringing in any lab work or testing that you've had done, so that we can really get to know you and figure out exactly what's going on and what your root cause is. And once we've done that, we're going to write out some blood work for you or whatever testing that you need. Right? If you're having gut issues, we might need some blood work and a stool test. If you're having hormone issues, we might need to do hormone testing or nutrient testing. But that first visit is all about getting a history, spending time with you, and actually figuring out what's going on. And once we have that information, we'll order whatever testing that you're missing. Okay? And normally that testing could take anywhere from 2 to 3 weeks to process. And the second step of our functional medicine process is sitting down with you for a second time and going over all the testing we just got back. Again, nutrient testing, stool testing, blood work. We'll put all the testing together with the history that we have, and we'll sit down and we'll actually outline a full-on game plan. We'll give you homework right then and there to do to start to take action. I'll give you a quick example. Say it's someone with an autoimmune thyroid issue. That testing might have showed us what is wrong with the gut. And it could have showed us there's deficiencies and some imbalances with the thyroid. So we might have 3 different things that we want to work on with you. So on that second visit, I will give you homework, tell you what to start doing maybe for a month or 2. And then, once we've healed the gut, then we can move on to the thyroid, right? And then once the thyroid's done, then we can move on to hormones, right? So normally, based on how many dysfunctions and issues you have, it could take a couple visits to address each problem individually. But most of our patients look back 6 months or a year later at the process and their life has changed. They've come so far. So a lot of times it does take more than a visit or 2, but that 2-visit, 2-step process is the way, that's where the magic is made. That's where we get all the information, and we can outline an entire plan of action that you can take home, and you can do that on your own. Right, we'll outline, hey, first treat the gut and take these things to do it. The second step, you're going to take these things to address it. So we'll outline everything you need to do. If you need our help in the future, we're here. If you want to do it on your own, great. That's our 2-step process really to get to the root cause of your issues. Now, functional medicine, let me explain that a little bit more. Standard medicine is really doing very basic labs and trying to treat the symptom. Right? It's here's your problem, here's a medication to treat the symptom. Conventional medicine is not designed to look at your lifestyle, look at nutrition, and really dig deep to figure the underlying cause. And really it comes down to time. These practitioners in conventional medicine aren't allotted the time to sit down with you, figure out what's going on, and treat you like you need to be treated. So functional medicine, we don't look at the symptom, we look at the underlying cause, and that takes time, right? And that takes specialized testing to figure that out. So that's really the difference between conventional medicine and functional medicine, and that's the process that we use here at this clinic to get you well. Thanks.